Okay, let's take a look at this 60-year-old man with a serum PSA of 6.5 who previously, years past, had a negative biopsy for cancer. And he is undergoing serial evaluation and surveillance. So here is his axial 2D fast spin echo. And I'd like you to kind of follow along in the middle and on the right. I'm going to make the right side a little bit bigger so that you can see where you are. So this is your coronal, this is your sagittal, this is your axial, all 2D FSE. Let's see where we are. We're up near the base. So at the base, we're going to see mostly transitional and central zone tissue or central region tissue. So let's draw that out for you. We've got this area right here, which is composed of the TZ and CZ. The CZ is kind of this tissue in the back, and the slightly more hyperintense tissue around the edges and maybe a little bit around the back is going to be the peripheral zone. So let's draw over the peripheral zone. And then the peripheral zone is going to have a PZA, a PZP for posterior, and a PZM. Now, there's a lot less peripheral zone when you're up at the base. In fact, near the back, there's hardly any peripheral zone. So in earnest, the central zone, which is kind of hard to see in this axial, is back a little further. The urethra is also hard to see, but you can cross-reference it in the sagittal by just putting a dot right there at the bladder opening. And that gives you a pretty good shot right at the base for the urethra. In fact, when we're up really high now, you see almost no peripheral zone. This is all central region portion of the gland. You see a little bit of the urethra and the periurethral tissues. So central region consists of central zone and transitional zone. Now let's work our way down. We're at the base. We pick up a little bit of peripheral zone here and here, mostly central zone and transitional zone, periurethral tissues. Let's keep going down. Now we're picking up the anterior fibromuscular stroma, this darker lentiform area, a little bit easier to see on the right than on the left. Let's take it away, and now let's put it back. I'm going to put it back with a different color. I like to put the anterior fibromuscular stroma in red. And let's take a look at the central region of the prostate gland, which consists mostly of the TZ. And then this patient's peripheral region, not as hyperintense as you would usually expect. And we're going to see how that plays into our RADS grading, but let's color over it. So we're going to color over it right now. I'm going to make that blue. Now, as we go more inferior on the sagittal and the coronal, things are going to start to look a little bit different because we're going to start to pick up a little more peripheral zone. So let's do that. Let's go down a bit, a few slices. And we have picked up, indeed, a lot more peripheral zone. Here it is. I'm going to draw over it in blue. There's the anatomic capsule. This is the surgical capsule. And everything in between, PZ, or peripheral zone. PZA, PZP, PZM. And central region of the prostate. And there's a little bit more of our lentiform anterior fibromuscular stroma. Comes a little bit more off to the left side. So everything that is uncolored is central region of the prostate. It's not unusual to not be able to see the urethra, which is going to make an angled turn for the anterior. So it's probably right there, and the tissue behind it is the vireo montanum. Let's keep going, shall we? And I refer you to the anatomic vignette if you want to know more about the anatomy. Let's go down all the way to the apex. We're in the apex of the gland. We'll take two slices and toggle them back and forth. Well, let's take this one. And we've got quite a bit of peripheral zone present now. Let's go back to our very beautiful blue color, which I love. And let's demarcate the central region of the prostate. There's a little vessel right there, or some area of hyperintensity. I'm going to ignore it for right now. There's the anatomic capsule of the prostate, this is all peripheral zone. Everything uncolored is central region of the prostate, or TZ, transitional zone, and we see a bit of fibromuscular stroma or anterior stroma anteriorly. And we're starting to see a little urethral opening again. So this would be the apex of the prostate. So if we had a cancer, say right here, we would say it's in the apical right PZA, or anterior aspect of the right peripheral zone. And we would look to see if it grew into the fibromuscular stroma, grew in front of the fibromuscular stroma, going into the preprostatic space of Retzius, going through the capsule, etc. If it was back here, it would be PZP. If it was back here, it would be PZM. On the other hand, if we had a central zone abnormality on the T2 weighted image that was decisive and worrisome, it might look something like this. It would look like charcoal smearing away this architecture so that all you see is a big gray blob that may even cross over into the peripheral zone. That would be a worrisome TZ abnormality. But fortunately, we don't have it. So we work our way up and down. We look at the anatomic capsule. We look at the integrity of the surgical capsule between the central region and the peripheral region of the prostate gland. We look at the preprostatic fat. We evaluate the seminal vesicles, the ejaculatory ducts, the little bright thing right here. And we look at the periprostatic fat on the T1 weighted image, which we'll show you in a moment. The rectum has been evacuated. There's virtually no air in it, and that allows us to get a high-quality axial image. In the sagittal projection, we see the urethral opening to help us identify the midline. It goes back and then goes forward as we come down. The periurethral tissues are just a little bit brighter than the rest of the central region of the prostate. Now, this area here that's a little bit dark, especially as we go off to the side, I'm going to draw over it right here, in the posterior superior quadrant. Now I'll go off to the side and follow it. That's the central zone of the prostate, part of the central region of the prostate. And we run into the seminal vesicle, which has variable signal intensity because it's a gland. So you may have inspissated secretions, darker, or very hyperintense secretions, lighter. And we go over to the other side, same thing applies. You see a little bit of glandularity, acinar-like character to the seminal vesicle, and the posterior superior area is the central zone of the central region of the prostate. Now, how about the peripheral region of the prostate? That's a little bit tougher in this case, because this patient has a slightly hypointense peripheral zone. We see it as a J-shaped structure right here. It's a little darker than usual. But nevertheless, that is not a criteria for a cancer. In fact, that's a scoring system peripheral zone criteria 2. Not a PIRADS 2. A scoring criteria 2 for the peripheral zone. What's the scoring criteria 1? Uniformly bright signal intensity in the peripheral zone. So let's draw over our peripheral zone. Take whatever color we've got. It's got this sort of J-shaped look, and look how anterior it goes. And then this darker area in front, very slit-like in this projection. I'll make it even a little smaller line. And this time I will make it, I'll make it pink just to stand out, is the anterior fibromuscular stroma. And then everything in the middle is going to be TZ, transitional zone. So let's draw over the transitional zone. Let's make it blue. And we're off to the side now. And we probably have a little bit of CZ kind of encroaching on here and meeting the PZ. That's a little better depicted in the coronal projection, as I'll show you in a moment. Now, one of the reasons why we're showing this as a PIRADS 1 is there's very little heterogeneity within the transitional zone. It's pretty hard to find a PIRADS 1 because all adult males have some degree of nodularity in their prostate, in the TZ. And those nodules can be very bright or very gray. but they must be well encapsulated. Here we have just a little bit of heterogeneity, but not much. No encapsulated dominant nodules. Oh, there's a little dot there. Okay, we'll write that off. And the peripheral zone has no masses. Granted, it is a little dark, so that would give it a score of 2. The transitional zone has probably a score of 1 or 2. It's a little bit heterogeneous, but not much. So I would give it a score of 1. These dots I probably would ignore. And then I would go over to my diffusion image to check out the absence of any diffusion restriction whatsoever to give this a PI-RADS score of 1. Remember, the major criteria for the central region, the T2 character. No dominant nodules, no dominant masses, no charcoal-like erasure-like masses that cross boundaries. And we don't have that. Yeah, we have a couple of dots. The major criteria for the peripheral zone, no diffusion restriction. And we're going to see we don't have any diffusion restriction. So we have no major criteria met in either zone. Let's go over and look at the coronal projection on the T2. And we're going to start in the back. In fact, all the way in the back, out of the gland. And out of the gland, we see the seminal vesicles. They're a little tougher because they're a little grayer than usual. And then the vas deferens with the duct within the vas deferens. And you would have the ejaculatory duct right here on the right. So we're in the back of the gland. Now we're behind the gland. Let's go to the back of the gland, the very back. And we see 2 gray blobs that kind of meet in the middle. And there's a little fibromuscular septum right here, which can sometimes masquerade as a mass. You can sort of see a squiggly dark line right here on one side, and maybe a squiggly dark line on the other side. I might even make it a little bigger for you. And at this locus, we are seeing almost exclusively transitional zone and central zone tissue making up the central region of the prostate. So let's draw over with my favorite central zone color, green, the central zone on the right, the central zone on the left. This is probably a little more central zone right here. This is probably some volume averaging right here. And then let's color in the transitional zone. Let's make that kind of a lighter orange. And then unfortunately, in this particular person, there's not a lot of discriminatory signal between the central and peripheral zone in this projection. We're going to see it a little better as we come forward, but we're volume averaging a little bit of the peripheral zone with the central region of the prostate. I'm going to give it the color purple, but it would be kind of down here if we could discriminate it. And granted, we can't, but we're going to use the other projections and keep going. Life isn't perfect. Get over it. So here is the coronal. Let's go forward now. Now you can really discriminate it on the very next cut. So now we've got a better view of the CZ. Make it green again. CZ. TZ. This is going to be TZ in here, filling in. And this is kind of all transitional zone right here. And then peripheral zone we start to see very well. Let's make that a nice color blue. We've got quite a bit of peripheral zone now coming into view, going all the way to the apex. Now let's keep coming forward. We're going to run into better discriminatory character between the PZ and the central region of the prostate gland. This lighter area represents the periurethral zone within the central region of the prostate. There's the urethra. Let's keep going forward. Same thing. Central region of the prostate gland, peripheral region, much thinner now. Coming forward, central region of the prostate, a little bit of peripheral region, a little harder to see. There's a little more peripheral tissue. I'm going to draw over it right here, there, and there. And then we keep coming forward. Now we're starting to get out of the prostate gland. We're in the fibromuscular stroma now, which assumes a bit darker character. The sagittal projection. Let's stay in the midline. we have a relatively homogeneous central region, although some innate heterogeneity is there because you have a central zone and a transitional zone and a periurethral zone, which is a little bit brighter, but no dominant bright or gray nodules, no erasure of the anatomy. Posterior-superior, central zone of the central region. More in the middle, transitional zone and periurethral zone. And those would go off to the side. So we could go either way, and still this area would be TZ. But as we go off to the side, now we start to hit a lighter signal that makes a J shape. As we pointed out earlier, there it is. I'm going to take an even more peripheral cut, and I'm just going to color the PZ in for you. This is all PZ right here. This is PZ, peripheral zone. This is PZA and apical too. Anterior and low, apical. This would be PZP and also closer to the base. PZP, posterior, and base. And this is your central region, which is mostly now transitional zone off to the side. Now, the reason this is a PIRADS 1 is there is no diffusion restriction in the peripheral zone. Major criteria. So let's go to the peripheral zone and look at the diffusion image. We're going to take each diffusion image, and the B value is going up. We got a B value of 0, and then a B value of 900, and then a B value of 1200. Let's flatten it out so you can see it. And if there was diffusion restriction, when we get to, say, 1600, you should be seeing a bright nodular mass-like area in the peripheral zone if you did not have a PIRADS 1 and you had a PIRADS 4 or 5. We don't have that. We don't have anything that is going up in signal intensity as we go from low to intermediate to high B values. In fact, the signals are almost uniformly going down. What about our ADC map? Do we have any dominant areas of low signal? Let's check it out. No, we don't. That's a dot. That is not an area of low signal that meets criteria. It's just a spot, another little spot. And you get these little spots at areas of signal decrease, or signal poor areas will show up as dark on the ADC map. That can either be from fibrosis or pixelation or a number of other causes that we'll describe in the pitfall section. But in order to have an ADC map abnormality, I want it to be 3 to 5 millimeters or greater. And we don't have that. That's about 1 millimeter. So negative ADC map, negative diffusion image for the peripheral zone. We've already hit the major criteria for the TZ, which is the T2. No nodules, no masses, no erasure, no invasion. So this qualifies as a PIRADS 1. What about the DCE MRI? Let's see if we can find it. We've got it right here. So this would be your mask. And on the right, I'm going to put the subtraction. So let's go through our mask, see when the contrast arrives. It has not arrived yet. Let's keep looking. Not arrived yet. Not arrived yet. It's arrived. Contrast is there. And we see symmetric central region, TZ area, and periurethral enhancement, which is quite common, and that'll progressively wash in over time. Let's keep looking at it. Each one of these is between 7 and 12 seconds per run. So another, let's say 10 seconds. So the first one was at 10. This is at 20. Now we go to 30 seconds, and it progressively gets brighter and brighter and brighter. You can also subtract this information, which is what was done on the right. Let's look at the subtraction. You'll see that central periurethral enhancement right there. And you'll see it get brighter. The rest of the gland starts to catch up, and brighter and brighter. It is very common to see enhancement in the central region, especially associated with BPH nodules. It is less common to see it with BPH nodules that are very bright on T2. It is usually the solid, well-encapsulated ones that enhance. So this is normal periurethral zone in the central region of the prostate enhancement. It's absolutely and totally symmetric. It does not in any way adversely affect your criteria of a PI-RADS 1. This is a PI-RADS 1. One more caveat. Let's bring down our last sequence, the T1 basic spin echo. And what are we using that for? To look at the surrounding fatty tissues, the preprostatic or retropubic space of Retzius, to look at the rectoprostatic fat, to look at the little dots surrounded by fat, the neurovascular bundle, to make sure the anatomic capsule of the prostate is not violated, to evaluate the presence or absence of lymphadenopathy, of which there is none, and perhaps to evaluate the skeleton to look for hypointense sclerotic metastases. The entirety of a study using 2D technique, a PI-RADS 1, where you've seen DCE MRI for the PZ, T2 for the TZ. You've gotten to look at the ADC map. You've seen how we use the T1 weighted image to look at the surrounding fatty tissues, and the dynamic contrast enhanced MRI showing physiologic normal anatomic enhancement. We've showed you how to go back and forth and evaluate the anatomy and the labeling in the sagittal, the axial, and the coronal projection. Let's move on, and if you have time, you might want to look at the 3D T2 presentation of this same protocol.